Okay. So I just have a few questions for my school
Okay.
project. Um, so I heard you work with poverty and healthcare.
I work with people living in poverty.
Yeah.
Yes.
Okay. Can you describe the social problem and your connection to it?
That's a big one. Are you a social work student at MTSU or?
Yeah, I'm majoring in criminal justice and minoring in
Okay.
social work.
Okay. I teach in the social work department.
Okay.
Yeah, one class. Okay. Poverty is a huge problem. Wow. I don't even know where to start. Many people in Murfreesboro are living in poverty. Um, Affordable housing is a huge, huge issue. I'm shutting my door. Let me grab some of my stats real quick. I
You're
didn't
fine.
know for sure what you were going to be asking me
I
about.
know you're fine.
Um, Rutherford County is one of the has one of the most expensive housing. Rutherford, Williamson, Davidson in Tennessee, and in Tennessee to afford housing, you would need to um, make $24.10 an hour to afford a normal one bedroom house in Tennessee,
Oh wow.
one bedroom apartment or house. That's Murfreesboro, Nashville, and Franklin. And it would require you working 101 hours a week at minimum wage to afford a two-bedroom house. And um, that's just not very doable
Yeah.
at all. There's very little low cost housing in Tennessee, in Rutherford County. And it's a huge, huge, huge problem. And that means many people end up experiencing homelessness just because they can't afford the rent or living in poverty. And I
Mm-hmm.
know many people that are actually living in their vehicles that
Mm-hmm.
work at somewhere like Walmart or maybe a CNA at a nursing home or something, but still live in their cars just because they can't afford rent in this
Mm-hmm.
area. And they're trying to save, but it's very hard to just survive or live in a hotel and survive and ever save up enough money for deposits.
Yeah.
So the biggest issue we're seeing in Rutherford County is lack of affordable housing.
Yeah.
The other big issue is that minimum wage has not been changed in a long time, and people getting jobs at fast food places, at hospitals, as just maintenance workers, at hotels, as
Mm-hmm.
cleaning people. This type of job, people aren't making enough to afford the housing. So, lack of affordable housing, not a living wage. Another big issue with poverty is people not being on health care and not having insurance, and they rack up huge, huge, huge medical bills
Mm-hmm.
and are stuck in debt for a long time and unable to pay.
Yeah.
Um, and a huge issue going on right now is that because of the government shutdown, SNAP benefits are not available. And so there's
Mm-hmm.
going to be many people going without food. I have a client that is elderly. He has dementia
Mm-hmm.
and he lives on $936 a month. And losing his SNAP will impact him horribly. It'll be
Yeah.
devastating. And he doesn't have a car, he doesn't drive. He's not able to drive to a food pantry and get food. He was able
Mm-hmm.
to walk to a nearby grocery store and buy food with his food stamps. I know another person who is blind. She has a seeing eye dog. She's on SNAP, and Same thing. She's unable to drive or go to a food pantry. Sometimes you wait for a long time at a food pantry. Some food pantries may give you a box just full of a few canned goods, and others,
Hmm.
like Nourish Food Bank in town, will give you a lot of food. But I've known people wait for a couple hours just to get the food. And for people without a car, it's often very hard to
Yeah.
get to a food pantry. So SNAP not being available is devastating to
Yeah.
people living in poverty. So that's that. That's all I can think of. Do you have other questions for me?
Yeah. One of the questions is where do you get information about poverty and healthcare, but we can just stick to poverty about poverty.
Um, well, you can go on the internet and see how many people live um, under the poverty line in the
Yeah.
U.S. or in Tennessee. Um, there's yearly statistics on that.
What sources do you trust most and why
Regarding
regarding poverty?
what sources do I trust? I
Yeah,
don't
like
understand what that means.
so like if you were to research it, like what sources would you trust most when researching it?
Data from Second Harvest Food Bank, data from the National Alliance to End Homelessness, data from the United States government's last census on how many people are living in poverty. I would trust those sources.
Okay. Where do you see examples of this problem in the community or society at large?
Well, I see it where I work at Stepping Stones. I see it at Barnabas Vision. I see it at Journey Home. I see it in downtown Murfreesboro. I see people living in campsites. I see children coming to school that haven't eaten. Um, I see it all over the community.
Yeah. Okay. Are there any specific population groups that are most affected?
African Americans are disproportionately affected, uh, I think, due to past discrimination
Hmm.
and discrimination in jobs and housing opportunities that we have not overcome. Um, More of them live in poverty than equals the percentage. I think last data said about 18% of the population is African American. That may have changed, but more than that live in poverty. As far
Oh.
as homelessness, we're seeing more elderly people,
Hmm.
people that are unable to make it on their Social Security payment and are ending up experiencing homelessness and living in poverty.
Okay. That's awful. What are the biggest barriers people in poverty face when trying to access healthcare?
Well, without insurance, most doctors won't see them. The only place in Murfreesboro that'll see them without insurance is the St. Louis Clinic or the Primary Care Hope Clinic, the Hope Clinic.
Okay.
Those two places will see people without insurance, but the Hope Clinic, you still have to pay $25. And sometimes people can't even afford that.
Yeah.
Emergency room is required to do triage on someone,
Hmm.
um, but often you don't get you don't get great like cardiac care, neurology care if you don't have insurance.
Yeah. How do people typically cope when they cannot access care?
Mm. They're very stressed. They have anxiety issues. They're very frustrated. They're very angry. Um, they often end up with depression.
Hmm. What policies, programs, or community efforts have helped or failed to help improve access to healthcare for low-income people?
The Affordable Care Act helped a lot. TennCare helps a lot.
Mhm.
Medicare helps elderly people over 65 a lot. All three of those programs have helped improve healthcare in the United States.
Have any failed to help?
Well, not having universal health care, in my opinion, is an issue.
Mm-hmm.
The United States is the only wealthy country that doesn't, developed country. Canada does, European countries do have universal health care, that everyone has health care. It's not
Yeah.
an issue. Um, Not having universal care, health care hurts many people. People that fall through the cracks. They make a
Mm-hmm.
little too much for TennCare, but their employers don't offer insurance, and so they have no insurance.
Okay. How does poverty affect people's health beyond access to medical services? For example, nutrition, housing, mental health, and employment.
Mm-hmm. Mental health issues are worse among people that don't have access to health care. Um, Diabetes is higher in people that don't have access to health care. Death is higher in people that don't have access to health care. Chronic health conditions, I mentioned diabetes, but like heart issues, high blood pressure,
Mm-hmm.
all of those are higher in people that don't have access to health care.
Okay. What role do you think private sector, nonprofit, and government should each play in addressing these problems?
I think the government should institute universal health care. It will be expensive, but in the end, I think it would save hospitals. Many rural hospitals are going out of business
Mm-hmm.
because the insurance companies have all the power right now.
Mm-hmm.
I think nonprofits that help pay people's medical bills and churches that help pay medical bills do a great service to people. And I think organizations like St. Louis Clinic and the Hope Clinic are great nonprofits that are helping with people's medical needs that live in poverty.
Yep. From your perspective, what short-term and long-term changes would most improve healthcare outcomes for people living in poverty?
Long term, as I said before, creating universal health care, that
Yeah.
everyone has access to health care. Short term, hmm. I don't know.
That's
I
fine.
can't think of anything, short term. It's a very unfair system.
Yeah.
The CEO of Blue Cross Blue Shield made millions and millions last year. And
Mm-hmm.
the CEOs of drug companies make millions and billions. And a huge percentage of our population doesn't have access to health care. Um, Women are dying
Mm-hmm.
uh, in childbirth in the US, which shouldn't be happening because they
Mm-hmm.
don't have access to hospitals. So I don't know a short term fix.
Yeah. Is there anything we haven't discussed that you think is important for people to be studying this issue to understand?
I think we need people to speak up, to talk to our legislators about how serious the problem is. People living in poverty don't have lobbyists
Mm-hmm.
like the drug companies and the insurance companies do. And I think it takes social workers, Christians, um, people that actually work with people living in poverty to say things. Say, hey, I'm not okay
Yeah.
with my neighbor dying in childbirth because they couldn't get, because their county doesn't have a hospital anymore. We've got several counties in Tennessee that no longer have hospitals,
Mm-hmm.
and women don't get the prenatal care they need. I think it takes all of us speaking up and saying, I'm not okay with that.
Yeah. Well, that's all my questions. Thank you for talking with
Okay, you're
me.
welcome. You're welcome, Kara. Now, how do you know Malia?
My mom works with her,
Okay, who's your mom?
Felicia Reed.
Oh, I don't know Felicia. I know Jessica that Malia works with.
Yeah,
But okay, well, it's nice to meet you, Kara.
it's
I
nice
hope
to
I
meet you
helped a
too.
little.
You did. Thank you so much.
You're welcome.
You have a good day.
You too. Bye bye.
Bye.